it's Courtney from Dr. Bird's office. So we are going to run through some simple self-MLD techniques because I know that a lot of people are having trouble getting an appointment right now for MLD. So these are some simple techniques that you can do at home that will help with your swelling and to get your lymph moving. So the first video that we're going to do is just for lower extremity. So any surgery that you've had on your legs, butt, hips, this video is going to be for you. So the first thing that we always want to decongest are the lymph nodes right behind the collarbone. So you're going to place your hands right in that hollow space behind the collarbone, and you're going to do gentle semicircles, okay? So each step that we're going to do, you're going to do it 5 to 7 times in order to clear that area. If you're doing these techniques to yourself, you can cross your arms and decongest your neck that way. So after we've cleared the lymph nodes out at the neck, we're going to move down to the stomach. You're going to do 5 to 7. You're kind of going to push in over the belly button and scoop up, okay? You're going to do that 5 to 7 times. You can also do these exercises while you're doing your deep breathing. So if you take a deep breath in, good, and then you blow it out, we're going to scoop on the breath out, okay? We're going to repeat, good. So we'll do 5 to 7 times right over the belly button, and then you're going to place your hand on each side right above where your hip bone is, and you're also going to do 5 to 7 scoops towards the belly button. We're going to go on the other side. We're going to scoop again towards the belly button. You'll go under each rib, and you're going to scoop towards the center of your stomach. And we'll do that on both sides. And then again, we're just going to go right back over the belly button and do a few more scoops. So you want to do each of those hand placements 5 to 7 times just to make sure that your trunk is really good and decongested before you move to the legs. So after that, we're going to stimulate and clear out your inguinal nodes. So those are right in the crease here at the top of your leg and where your groin is. So again, you're going to just do gentle semicircles, okay? 5 to 7 times, scooping right here at the inguinal nodes. Once we have done that, we're going to work on the outside of the thigh. So you're going to place your hand right along the outer thigh, and you're going to do gentle scoops moving from your knee up towards your hip. Each time that you go from your knee to your hip, that counts as one pass. And again, we have to do this 5 to 7 times. So once we've done the outer hip, we're going to do, the outer thigh, we're going to do the top of your thigh. And again, it's just gentle circles from your knee to your groin. We'll do that 5 to 7 times. And then we're going to do the inner part of your thigh. So you're actually going to place your hand, you're going to push down to stretch that skin and scoop up towards your groin. Again, right to that area where your inguinal nodes are. So we're going to start again right where the knee is. Do really gentle semicircles from the knee up to the groin. So once we've decongested the thigh, we're going to then move to the knee.
Sorry for my dry legs.
No, you can't tell. So you want to do the top of your knee first, okay? So it's really important that you do this really gently over the top of your knee. You're almost just placing your hand and stretching that skin upwards. So you don't want to push down into your kneecap. It should not be painful. You're literally just moving the skin on the top of the knee in this sort of pumping motion. After we've done that 5 to 7 times, we can go on the sides of the knee. You're going to stretch that skin down and scoop up. So that's 5 to 7 times there. Then you're going to place your hand gently right under your knee crease. And again, you're just doing very gentle scoops up 5 to 7 times. You then want to stimulate this little area of the leg that we call the bottleneck area. That's where a lot of your lymph fluid drains. So you just want to gently place your hand right there at the top of your, the inner part where your lower leg meets your knee, right here. And again, we're just going to do 5 to 7 times, gently scooping. Okay, then you can sort of bend your knee. We want to do a gentle pumping motion on the front of the leg, right over your shin. Again, it's really important when you're doing these techniques that you just feel that you're moving the skin. You're not trying to get to the muscular level. You're not digging down with your fingers. It's just a very gentle movement of the skin. For the back of your leg, it's more of that scoop, okay? So you're gonna be working from your ankle here all the way up to your knee crease. So again, just like your thigh, every time you go from your ankle up to your knee, that counts as one pass, and you need to do the front and the back both 5 to 7 times. We're gonna put this foot flat. Soft tab. So for the ankle, kind of like you have positioned your hands up here at the knee, you're also going to kind of cradle the ankle in your hands, and you're gonna do 5 to 7 scoops right behind your ankle bone to encourage your ankle to drain. You want to keep a nice soft hand while you do this. You don't want your hand to be super rigid or hard. And then you can just do some gentle strokes over the foot. Again, we're just doing that scoop motion. We always want to be moving lymph up the body. So your scoop should always be that direction. So once you've sort of worked your way down to the foot, you can just gently sort of scoop all the way back up the leg a few times. And now you're ready to move and do the other leg. So then you would, again, you would start in the inguinal nodes where your groin is. You would do the outer thigh, top of the thigh, inner thigh, top of the knee, sides of the knee, underneath the knee. You would bend your knee, do front of your leg, your shin, then behind on your calf. We would do both sides of the ankles, top of the foot, and work back up. You can always finish by reworking your trunk again. You can do some more of those deep breathing exercises. You can kind of do that, that scooping motion over your belly button, and that should help to clear out your trunk. So that is the video for self MLD for the legs.